The government response to the COVID-19 pandemic triggered some of the most aggressive usurpations of freedom present-day Americans have experienced.
But they want us to believe it was a bat to a pangolin to a hippopotamus to Joe Rogan, and then we all get the virus. Wow, groundbreaking.
Vaccines in general in the United States, but particularly COVID-19 vaccines, have not received unbiased scrutiny.
Patio World was forced to close and couldn't sell outdoor furniture because it was a small retailer, but Costco could sell the same products.
Why did you alter the information in that study?
That is factually incorrect. I did not alter any findings in any study. That was a very unpopular finding, but is very consistent with the finding that myocarditis is especially increased in young men. The study was performed by epidemiologists at the Florida Department of Health.
Under this WHO treaty, we would effectively be ceding all such discretion to international bodies.
How did you and the governor of Florida manage to time travel into the future and gain access to knowledge and wisdom that is only available to the likes of the governor of California?
Our Democrat mayor ordered around 500 basketball nets removed from public courts because, God forbid, anyone have any fun outside to get essential vitamins and fresh air. Let's take a look at Black Panther. I'm sorry, that's Kunta Kinte. I'm sorry, Nancy Pelosi, Wakanda forever.
Now, before I recognize myself for an opening statement, we have a video prepared on behalf of the committee.
Schools, businesses, nearly every aspect of American life shut down.
Biden and Harris called for this nationwide mandate.
It's not about your rights, it's about your responsibilities.
Just think of this when you think of vaccination.
This is not about freedom or personal choice.
New pandemic restrictions are coming into effect tonight.
Put into practice the 15 days to slow the spread.
A statewide order for people to stay at home.
To get into these venues, they include bars, restaurants, nightclubs, conference centers.
For domestic travel, for interstate travel, for planes, trains, interstate buses.
Mr. Rodney Howard-Browne is accused of defiantly leading two heavily attended church services.
Mayor Michael Hancock told residents of his city to skip large Thanksgiving dinners.
Restaurants must close up their dining rooms by 10 p.m.
Use lockdowns to get people vaccinated.
New York City schools, the largest in the nation, on the brink of shutting down.
The Pentagon says it will not give back pay to military members who refuse to get the COVID-19 vaccine.
There will be a civil fine and mandatory closure for any business that is not in compliance.
Now is the time to do what you're told.
I'm not going to sign any bill that takes authority away from me.
Many of us are frustrated with the nearly 80 million Americans who are still not vaccinated.
Democratic leaders apologizing or reversing course after multiple occurrences of do as I say, not as I do.
We've been patient, but our patience is wearing thin, and your refusal has cost all of us.
Dr. Fauci and the NIAID as a sponsor of her research.
I want to know what their scientific evidence is that we need to have children as young as 2 being forced to wear a mask.
He was engaged in a massive but a very effective cover-up of his funding of gain-of-function research at the Wuhan lab.
I am strongly in favor of mandating.
The government response to the COVID-19 pandemic triggered some of the most aggressive usurpations of freedom present-day Americans have experienced. When we look back at the trillions of dollars spent, the immeasurable loss of freedom, the loss of jobs and businesses, the lost confidence in public health, and the immense societal harm created, Americans deserve to know it will not happen again. Every level of government, federal, state, and local, to some degree took part in this attack on the liberty of the American people. And corporate America, academia, and the media were happy to oblige. An apology, if we are lucky to get one, does not change the fact that the effects of COVID-19 tyranny are permanent if we don't act to change them. I will remind both my Democrat and Republican colleagues that the liberties reflected in our Constitution are not optional, and as a general matter should not be suspended for political expediency nor times of crises.
So many of the things that particularly the Biden administration told us turned out to be wrong. Bad enough you got to give up your rights, but you give them up when they're telling you for wrong reasons. I mean, you could go down the list. They told us it wasn't our tax dollars used in the lab in China. Yes, it was. Yes, it was. They told us they weren't doing gain-of-function research. Yes, they were. They told us it didn't start in the lab. They didn't start in the lab. Sure looks like it did, but they want us to believe it was a bat to a pangolin to a hippopotamus, to Joe Rogan, and then we all get the virus, right? That's what they want us to think. I kind of think it started in the lab. But But no, we're all stupid. They're so much smarter than us, and they're going to restrict our liberties while they're telling us they're smarter than us, even though they were wrong. They said the vaccinated couldn't get it. They said the vaccinated couldn't transmit it. They said masks work. They said kids couldn't go to school. That was you can just keep going down the list. Maybe here's the other one. They said for the first time in history, we have a virus where there's no natural immunity. Wow. Groundbreaking.
First, I'd like to recognize Ms. Harmeet Dhillon. Ms. Dhillon is a nationally recognized civil rights lawyer and the founder and chief executive officer of the Center for American Liberty. Dr. Joseph Ladapo. Dr. Ladapo is the Surgeon General of the state of Florida and a professor at the University of Florida College of Medicine. Introduce Ms. Claudine Geoghegan. Ms. Geoghegan is a visiting fellow at the Independent Women's Forum. She is also a co-founder of Freedom in Education, a nonprofit organization. Professor Michele Goodwin. Ms. Goodwin is the Linda D. and Timothy J. O'Neill Professor of Constitutional Law and Global Health Policy at the Georgetown University Law School. Dr. Ladapo, about 100 million Americans were placed under essentially federal mandates with respect to vaccines. Some of those have been struck down, correct?
That's correct.
And, but nevertheless, there were still a whole lot of pressures for people to be vaccinated and to get the vaccine or lose their job. Is that correct?
Tremendous pressure, and many people, in fact, did lose their jobs.
Can you expound on the extent to which both whatever happened in the grand jury or in your own observation, what has led you to believe that the mRNA vaccine should be taking a second look and shouldn't be out there, and your concerns about the health issues, the million cases that have been reported through the VAERS system, et cetera? Can you expound on your concerns about the vaccines?
Sure. Thank you for that question, Chair. It's hard to be an honest person or have any relationship with honesty and not acknowledge that over the last few years, negative information, negative scientific findings, negative impressions about the mRNA COVID-19 vaccines have been, to at least some extent, suppressed. Most people, I think, with some relationship to honesty would agree that they have actually been quite strongly suppressed often. However, there are a number of scientists in this country who have been vocal about the problems with the mRNA COVID-19 vaccines. It's noteworthy to view the fact that never in our history have there been so many physicians and other scientists who have been outspoken. It's unusual for scientists. Scientists usually pursue their science for the benefit of their curiosity and research, or for the benefit of human health. Scientists are usually not political figures.
Do you share my concern that a mere 11 COVID countermeasure injury claims have been paid out through the compensation fund?
Absolutely.
Is that an astoundingly low number given the millions of Americans that have been effectively forced or strongly encouraged or coerced to take the vaccine?
I think it's obvious, and it would be hard for anyone with, again, any relationship to honesty and facts to deny that.
Do you believe that that has been somewhat encouraged by the extent to which there is liability protection for vaccine manufacturers that dates back to 1986, and that we should at least revisit the nature of liability protection for pharmaceutical companies?
I actually, personally, I completely agree with that. I think this liability protection for any medical product is something that really shouldn't exist. And it's particularly egregious when it's a product that's being mandated, whatever that medication might be.
And to be clear, though, you, like me, are pro-vaccine, right? But tested vaccines and so forth. For example, my father had polio, and I am grateful that we have a polio vaccine. But they should be thoroughly tested, thoroughly reviewed, not under emergency use authorization, not forced on the American people, and not under the rubric or umbrella of liability protections that potentially endanger the American people. Would you agree with that sentiment?
Totally. I think it's important that whatever the medication is, it receives a fair evaluation and not a biased evaluation. And unfortunately, vaccines in general in the United States, but particularly COVID-19 vaccines, have not received unbiased scrutiny.
Ms. Dhillon, could you comment a little bit further on, you mentioned some, you don't need to repeat the ones in your opening statement, but some of the egregious violations of people's First Amendment rights because churches were shut down, or the extent to which, in your experience, lockdowns forced upon the American people a massive restriction of their ability to assemble under the Constitution or carry out their First Amendment rights. Could you use the microphone, Ms. Dhillon?
Yes, sir, thank you for the question. Chairman, I'll give you one example. In our third case that's now set major precedent in the United States Supreme Court on religious liberties, Tandon versus Newsom, the case involved members of a very small congregation who wanted to do Bible study in a private home. And under our governor's restrictions, this was illegal. This was a violation of his executive orders. At the same time, those three people could have met in the aisle of a Costco and had a prayer meeting there without violating any rules. This is clearly irrational, and it is frankly unconstitutional, because I don't have a constitutional right to go to a big box store and buy supersized bags of toilet paper, but I do have a constitutional right to worship with other fellow Americans, and the Supreme Court recognized that. Yet another example of this irrationality is the closing of the beaches of Orange County in retaliation for Orange County's attempts to pass some reasonable business opening measures. And I see my...
Let me finish the question.
And one more I would add is the fact that Patio World was forced to close and couldn't sell outdoor furniture because it was a small retailer, but Costco could sell the same products. Costco had better lobbyists than Patio World. These are the irrationalities that we all tolerated and nodded, importantly, that was necessary to protect the public. Clearly nonsense.
Professor Goodwin, in my opening statement, I argued that in response to the COVID-19 pandemic, public health officials at the local, state, and federal levels acted in good faith, doing the best they could under tremendously difficult circumstances to respond to a novel disease that in the early days of the pandemic was killing almost 1,000 Americans a day before a vaccine was developed. Do you agree with this characterization?
It's an accurate characterization. It's a characterization that is confirmed by leading medical organizations and scientists that were studying COVID-19 and its impacts at that time.
And can you remind us of the conditions that public health officials were operating under at the beginning of the pandemic?
They were operating under extreme difficulties during that time, given the number of deaths that were taking place at that time, given the number of individuals that were being hospitalized at that time, the grieving of family members whose loved ones were dying, and they were working as quickly and as effectively as they possibly could. But it's also worth noting that they were operating under threat as well. And that was something incredibly unique, which I think we cannot forget in these times, the level of violence that was threatened at public health officials, which we've not seen in the last 50 or 100 or 200 years in this country.
How do we prevent this from ever happening again?
Thank you for the question, Congressman McClintock. I think the biggest thing that Congress could do right now is to overrule by legislation the outdated precedent, Jacobson versus Massachusetts. I hear people in this hearing praising it. At the time Jacobson versus Massachusetts was the law, Black people couldn't eat at the same places as white people. People like me from Punjab weren't allowed to buy property in the United States. We've had a lot of outdated laws and dark times in our country, and that precedent is one of them. And so when I hear passionate advocates for abortion cite it as a constitutional right, it is legally premised on tiered scrutiny under the 14th Amendment, which is scrutiny developed by progressive courts to protect our constitutional rights. And that is all I'm asking for, is that well-established tiered scrutiny be applied today in 2024 to the problems of 2024, not the problems of 150 years ago.
Limited, but
Dr., is it Ladapo? Is that how you pronounce it? Ladapo?
Sure, it's all good, either way.
No, but how do you pronounce your name?
Ladapo.
Ladapo. I like to get it right.
Okay, ma'am.
Are you a specialist in infectious diseases?
I am board certified in internal medicine, and internal medicine doctors take care of a wide variety of
Understood.
patients.
Are you a
especially
specialist? I asked a very
in
specific question.
infectious
Are
disease.
you a specialist in infectious diseases?
I'm board certified in internal
Okay,
medicine.
the
and
answer,
take
I
care
guess,
of
is
patients
no,
with-
which is
with-
okay. We're
with
moving
infectious
on.
diseases.
Are you a specialist in epidemiology?
I have
I see where
PhD
you're
training
going. Okay,
in
so you are
epidemiology.
not a specialist in epidemiology
I have
either.
PhD training in epidemiology and biostatistics and health economics.
Are you a vaccine researcher?
I am not a vaccine researcher.
Okay. I'm curious why you altered key findings in a state-driven study about COVID-19 in your state of Florida. Why did you alter the results of a state-driven survey? If I could, Mr. Chair, enter into the record, April 24th, 2023, political article, Florida Surgeon General altered key findings in study on COVID-19 vaccine. Why did you alter the information in that study?
Thank you for your question. That is factually incorrect. I did not alter any findings in any study, and I have a record of multiple NIH grants as a professor at UCLA and a professor at Florida, and those are not easy to get. The study you're talking about is a study that was very unpopular because we had a finding that actually was in sync with what you might expect from myocarditis,
Dr. Ladapo,
which is that we found that there was an increased risk of myocarditis
when
and
other
cardiac
people
death in young people.
in your home state had said on the record to the press that you altered the study, are you saying that is inaccurate?
I'm saying we have a study that showed that young men were at increased risk of cardiac. I've already answered that question, ma'am. I said absolutely not. I have never altered any study. We had a finding of increased cardiac risk that translated into excess deaths in young men in particular. That was a very unpopular finding, but is very consistent with the finding that myocarditis is especially increased in young men. The study was performed by epidemiologists at the Florida Department of Health, not by me. I oversaw the study, and that was the finding, and I personally believe that that finding is accurate.
I have another question. You had said in multiple op-eds, USA Today, March 26, 2020, Wall Street Journal, April 9th, 2020, that you spent time taking care of patients with COVID-19 at UCLA's flagship hospital, and yet your colleagues at that institution said that was not true. Did you, in fact, while you were on staff at UCLA's flagship hospital, were you the person charged with treating COVID-19 patients?
I have taken care of, at UCLA Hospital, as the attending physician, many patients with COVID-19.
Mr. Ladapo, the gentle lady from Vermont just questioned your credentials. Isn't it true you have a PhD and an MD from Harvard?
Yes, that's correct, but apparently not enough.
I guess not. Well, I'm going to say that the Pfizer CEO is a large animal veterinarian, okay? And then the person who actually approved the vaccines at the FDA is a hematologist oncologist who ran off the two top vaccine scientists at the FDA, Marion Gruber and Philip Krause, because they said that they would not skip steps to approve the vaccine. And then they also had hesitation about the boosters. He said not everybody's going to need a booster, especially not 8 months after they've received the vaccine. But they were the vaccine experts working at the FDA who were removed of their responsibilities by a guy who didn't replace them with vaccine experts. How do I know this? I was in a transcribed interview for 7 hours with this gentleman from the FDA yesterday. And what we also found out is that the FDA, whose role is to regulate the manufacturers, to make sure that what they say is true, that the claims can be verified. The FDA itself was going out and making 1-minute videos saying things that not only did the vaccine manufacturers not claim, for instance, that their vaccines could stop or slow the spread, but the vaccine manufacturers never asked for approval of to be able to say, and that the vaccine manufacturers would have gone to jail. The FDA would have probably arrested somebody if they had made the claims that the FDA itself was making. So we'll find out more about that later. But, let's talk very quickly, Ms. Dhillon, about the PrEP Act. or Mr. Ladapo. Is that something that Congress could remedy?
Well, the PrEP Act effectively protects the big drug companies from the defective products that they make. And I find it as a civil rights lawyer very problematic that that type of protection is granted freely by the government without even requiring anything on the part of the drug manufacturers. I know we want to promote industry, but I think it is time to re-examine the PrEP Act and roll it back.
Talk about this WHO treaty, this WHO treaty. What is the design there? You know, the biggest thing that concerns me is that as of now, if we had another crisis emerge, it almost looks like the same events would be repeated. And some are out there, I think, trying to make sure that government, that the factors limiting government, like litigation in our Constitution and so forth, will be even less effective by ceding power to international bodies like the WHO. Can you speak to that treaty we hear so much about?
Absolutely. So we had a mere iota here or there of some fundamental liberties being recognized by the federal courts, and under this WHO treaty, we would effectively be ceding all such discretion to international bodies. We've seen how that's worked out in real life in many other spheres of our lives. This is a country based on federalist principles. So generally speaking, states should be able to pass laws that protect rights. Judges should apply modern, not ancient constitutional principles dating back to bad eras of our country. And instead, we are going in the opposite direction with considering treaties that would cede that to countries that share none of our egalitarian values.
How did you and the governor of Florida manage to time travel into the future and gain access to knowledge and wisdom that is only available to the likes of the governor of California in retrospect?
Right. Thank you for your question. What was different with the policies that the governor enthusiastically endorsed and frankly had company in every state just about with the exception of a few, including Governor DeSantis, was that those were actually not classic public health principles. These are published studies and published papers about how to approach pandemics and public health crises. And one of those principles is to, as much as possible, help people maintain their normal routines. Old published papers state very clearly that the benefits, if any, of things like forcing people to stay home are unlikely to be realized. This is not new knowledge. This is old stuff. But unfortunately, none of it was followed when the COVID-19 pandemic started.
Well, thank you for your common sense and science-based policies. Millions of people, particularly kids in Florida, are much better off because of it. For the sake of sort of preserving our historic memory of what life actually was like in California during this period, could you just give us a few snapshots of sort of some of the worst abuses that we all had to endure?
Well, thank you, Congressman Kiley. And by the way, you were also a fellow warrior in that battle and went to court to challenge our governor. I appreciate that as a fellow lawyer. To me, the absurdity that certain people could cross county lines during the pandemic, but our governor forbade the rest of us from crossing county lines unless we had an essential purpose is one of those crazy issues. The fact that you needed a vaccine passport to eat in restaurants well into the pandemic, when in fact Governor Newsom with glee ate in the French Laundry restaurant that was cut off from the rest of us. The fact that Governor Newsom and other wealthy California elites were able to educate their own children in their backyards in pods and relegated the most vulnerable members of our society, inner city children, children for whom English is a second language in Los Angeles County, to destroyed careers and education, to a lifetime of less earning and less liberty, really, is an outrage. And everyone just simply wants to say, whoa, well, mistakes were made, we did the best we could at the same time. In fact, there were different rules for the elites in California and different rules for the rest of us. And the fact that judges pointed to Jacobson and said, Ms. Dhillon, we're not talking about deferential or rational basis scrutiny. No scrutiny is due to the government's action in shutting us down. And so my fear as a civil rights lawyer is that with the snap of a finger or the stroke of a pen, the very same civil liberties catastrophe could happen to us again unless Congress takes action to right that wrong.
I mean, we've heard some really extreme examples. Yes, in my community, there were restrictions on public gatherings. but people adapted. You know, we still have more people attending the virtual church ceremony at my church than attending in person. People had services outside. Schools adapted to online learning and implemented mask mandates. So these weren't complete restrictions on people's lives, and it's a little bit disingenuous to suggest that there weren't workarounds. Was there something you wanted to add?
Yeah, well, Americans adapted because they were compassionate. They cared about their neighbors, they cared about their family members, and for that reason, they did adapt. There were people, many of us, who suffered something during that time. My daughter was being educated in Europe during that time. It was a time in which I had to see her by looking on a screen in order to be with my daughter because the restrictions also included travel. But I cared about her health. I cared about her safety. I wanted her to be safe, and so that was an adaptation, and many people made them, and we've been able to come to a space where we could have a hearing such as this, where it looks like almost everyone in this room is unmasked.
To what extent did COVID-19 serve to change the election processes in this country in the lead up to the election?
Well, thank you for the question, Congressman. COVID-19 was used as an excuse by mainly Democrat lawmakers to one-way ratchet down the election integrity that we enjoy as Americans. For example, you just referred to the way that voting should be safe. Well, if masks worked and social distancing worked and we were all required to observe those measures, why couldn't we have voted in person using those measures just like we all went to the grocery stores and did our other business that way? It is the fact that in combination with the fact that we have unclean voter rolls in the United States, combine that with all mail voting, and you suddenly have a system where there are millions of unaccounted ballots floating around and not tied to voters who are entitled to vote. And unfortunately, many states, right and left, red and blue, used those COVID restrictions, used the COVID restrictions as a cover to change those laws. And now that COVID is effectively over, as it was pointed out, none of us are wearing masks here today, which, by the way, the paper masks don't work anyway. Why haven't we returned to those previously well-respected, documented ways of safe and secure voting? And the net result is that many Americans have lost confidence in the accuracy of our elections and don't want to vote anymore because they don't believe their votes are going to be accurately counted. This is a significant problem in voter confidence.
They told us to stay in our homes. They told us not to go to church. They told us not to attend funerals and only leave our homes for what they deemed to be essential travel. And when we rightly questioned the efficacy of their decrees, they told us to trust the science. Well, I'm about to show you what real fascism looks like. I'm about to show you what their science really looks like. During the pandemic, something struck me. People weren't allowed to use jogging or biking trails, even in my hometown of Houston, Texas. And speaking of Houston, our Democrat mayor ordered around 500 basketball nets removed from public courts because, God forbid, anyone have any fun outside to get essential vitamins and fresh air. Skate parks were filled with sand in California, so people couldn't play outside and, again, get fresh air. In Malibu, paddleboarders were arrested for the crime of paddleboarding alone in the middle of the ocean. However, one group of people were exempt from lockdowns, from mandates, and apparently from the virus itself. Now, I'm of the opinion that this group of people should have their blood tested because who knows? Maybe they had the cure before we had the vaccine. And I think you know what group I'm talking about. That's right, I am talking about the righteous George Floyd protesters. According to one political article, these protesters risked their health and their life for, quote, the health of our nation. And do you remember those same health professionals telling us to stay home or else you're going to kill grandma? 1,000 of those same health professionals signed a letter saying, don't shut down protests using coronavirus concerns as an excuse. Interesting. As an excuse. People lost their jobs and their livelihood in this country because they chose not to take the vaccine. People weren't allowed into restaurants because they didn't show their vaccine papers. Their vaccine card. Our schools were shut down and our children were sent home. The result? Youth suicide rates increased dramatically, and children lost years of education that they'll never get back. Dr. Ladapo, thank you for being here, sir. Yes or no, in your professional medical experience and Harvard education, as the Surgeon General of Florida, are Democrats and liberals immune to COVID-19?
No, sir, to the best of my knowledge.
A follow-up question to that. You set Florida's response to COVID-19, and how would you explain bodies not piling up in Los Angeles after the George Floyd protests?
For one, there was very, very, very little transmission outdoors. That was a major part. Most of the protesters, from what I saw, were young people that probably also contributed, but there was almost no transmission outdoors. And it broke my heart when they pulled the basketball hoops in the playgrounds that I was taking my kids to in Los Angeles. I mean, I could have, I'll stop it there, but broke my heart.
Thank you for your response. Much like the vast majority of liberal policies, this rule's for thee and not for me, and apparently that also applies to COVID lockdowns and mandates. It was okay to make exceptions for when the left believes was their righteous cause. The left said it was safe for 100,000 people to protest, 100,000 people in the middle of a pandemic, but they were giving you grief for letting people sit on the beach or paddleboard in the middle of the ocean. Why? Because in the case of the George Floyd protest, it was a righteous cause in their opinion. And by the way, it wasn't just protest, it was rioting, it was looting, it was attacking and burning a police station in Minneapolis, it was rioting in front of the White House to such an extent that President Trump had to be ushered into a bunker. And all this was acceptable because it was deemed righteous by the left. Speaking of righteous causes, let's take a look at Black Panther. I'm sorry, that's Kunta Kinte. I'm sorry, Nancy Pelosi, Wakanda forever. This is the absurdity of the COVID-19 lockdowns, liberal mandates, and of course, even a little cultural appropriations. This is very ridiculous. We must never allow something like this to ever happen again in this country. It's why we have a constitution in the first place, to protect us from the exact type of government overreach that we saw during the pandemic. No matter what side of the political aisle that you find yourself, you should always be on the side of freedom and preserving our rights via the Constitution. And that's why many of us walked away from the pandemic and the protests that followed, asking the question, were the COVID restrictions really about public safety, or were they about winning an election?
Does a mask work better in a classroom than on a football field?
Turns out it works about the same in both settings.
Is there a difference between Menards being open and a locally owned business?
To the owners, yes, but probably not to the virus.
Is there some super secret ventilation system I'm not aware of at Menards that local businesses are incapable of having?
I actually couldn't comment on that, but I probably would assume not.
When the clock turns 11 p.m. at a bar, does COVID become more contagious?
In some precincts, no, I'm kidding. No, it doesn't. It doesn't become more contagious.
These are all the ridiculous things that happened in my state. And I don't blame the teacher. And I actually don't blame the public health officials. I blame politicians on the right side of the aisle, the left side of the aisle, local officials, state officials, federal officials, who all hid under their desks and abdicated their responsibility to people who had never been elected to anything.
Ms. Geoghegan? Geoghegan. As a parent and former teacher, can you describe the harm that the closure of schools and remote learning inflicted on your children?
Yes, thank you for the question. Well, as I said in my oral testimony and went into greater detail in my written testimony, that mostly for my youngest son, because he was a junior when schools closed, and then his entire senior year was virtual. The best word I can use to describe that is it just delegitimized school for him. And I know it's not just him, it's many of his peers. I've talked to lots of parents. I was involved with parents in my community trying to get schools to reopen, and it's the same thing. And I think you can see that with the chronic absenteeism that we're now dealing with. Not only did it delegitimize school for the students, but it delegitimized it for the parents as well, because let's be honest, the parents are the ones that need to prompt their children to get to school every day, and they're not seeing the need to do that quite as much. I was just told that I think 60 60% of the students here, the high school students in DC are chronically absent, that's a big problem. So that's
And a lot of that stems from the policy decisions that were made during COVID.
Absolutely,
Okay.
yes.
Did you know that the declines in reading and math achievement during the pandemic were among the largest declines observed in a single assessment cycle of the National Assessment of Educational Progress program?
Yes, I am very aware of that.
And can you describe how students with special educational needs may have been particularly affected by school closures, mask mandates, and other COVID-19 measures?
So those stories are particularly heartbreaking because the students with special needs were especially hurt by those policies, and the parents who really depended on the special education teachers who are tremendous at what they do. They were disconnected from them. I actually have a special education degree. It is very challenging to provide special education via a screen. In many cases, it's nearly impossible. I volunteer in a school that was actually started because their schools were closed. This is an urban school, and I walked in, and we were never masked in that school. And the students in that school who were just failing in their public schools are now thriving, but they were never masked. They're very social. They communicate. In fact, one has even testified in Frankfort, Kentucky, in front of the Education Committee. So I can see the vast difference between the students who were masked and shut out and the students who were allowed to be in person, unmasked, and fully children.
That's an excellent observation to make.
With that, the hearing is adjourned.